of pharmacology as to what all aspects you would be covering throughout your entire year. So from MCI now it has become NMC, National Medical Council. This board, this central body has defined specific competencies in pharmacology practical. Competency in simpler terms means being able to do something. So this activity can be assessed on the basis of your knowledge, skills, and communication. Being able to do something in terms of either gaining knowledge, interpretation of knowledge, applications of knowledge. Skill based includes both application of knowledge as well as hands-on experiences and communication skills. Communication skills in terms of counseling the patient, especially both verbal and written, and by other methods. The broad goal of teaching UG students in pharmacology is to inculcate a rational and scientific basis of therapeutics. Now, what do you mean by rational? Can anyone throw some light on it as to what you understand by the word, the term rational? Rational in general sense. Because this terminology we'll be using throughout. Okay, scientifically proven. Okay, that is one aspect. Adequate. Okay. Adequate in terms of what? In terms of whom? Rational therapy, rational therapeutics. Logical. Okay, adequate in terms of validity, usage with a definite reason. Okay. So rational therapy in other terms is the concept of R's, various R's. You would be learning in the clinics too, where there is requirement of different R's, whether it's right diagnosis, right drug, right dose, right route, right dosing regimen in its entirety, for the right condition, for the right patient. So all those R's are involved in this rational, where you give someone had mentioned earlier, a scientifically proven therapy for a particular patient, the right patient in the right dose for its right condition, because the same situation in different persons would be requiring different drugs, different therapies. So this rationality of drug will be assessed and evaluated, and you would be practicing this rational drug therapy in the forms of various prescriptions, which you would be made to learn and given as assignments, so that you understand as to what would be the correct pharmacotherapy for a particular condition, for a particular patient. And so is the departmental goal to teach undergraduate students about the rational and scientific basis of therapeutics. As I mentioned earlier, that you would be tested on different competencies. Competencies make up this entire subject, and not just this, but all the subjects, where it is necessary and it is documented to be made sure as to what you're supposed to know, how you are supposed to be implementing those knowledge. So knowledge, skill, and communication. So these skills will be evaluated. Your skill sets will be evaluated by identifying.
Yes, ma'am. Yes, yes.
Some Yash, could you kindly mute yourself? Thank you. So the skill sets you would be made to learn will be teaching you via theory and practicals both, different aspects of each. One of the skills which you would be required to learn is to identify adverse reactions and interactions of commonly used drugs. Drug prescription has been a common thing, and since you all are in MBBS, even from first year onwards, you would have been asked to by the family and friends as to what is this drug, where is it used for, can this drug be given, can this drug be not given, in which condition it should be given, where it shouldn't be given, identification of the diagnosis, identification of various investigations. So those things would be starting from now on even more. And commonly, any patient would be prescribed more than one drug. Usual scenarios in the hospitals and clinics. So this can lead to interactions among the drugs used, which is called as drug-drug interactions. The other thing which you would be learning later on is food-drug interactions also. And all these interactions, as well as the inherent properties of the drug itself, can lead to adverse reaction. Not just skin manifestations of reactions, but other drug reactions. You'd be learning those. Another another idea which you would be given as one of your practicals, I think two of your practicals would be study of effects of drugs. Designed for the study of effects of drugs. Bioassay is not particularly for you, and interpretation of experimental data. So we have practicals on the basis of experimental data where there are graphs of animal experiments. You would be asked to interpret them and correlate it with theory as well. And experiments designed for the study of drugs you would be made to understand via computer assisted learning. Now, animal experimentation requires injury, damage, or killing of animals. So, to prevent more of this inhumane acts and to observe experiments in already established drug therapies, there are computer simulations. These computer simulations allowed to understand and perform on a computer itself. So this simulation will be helpful in understanding as to what drug leads to what in animals. You'll be learning at a later stage. Scan information on common pharmaceutical preparations and critically evaluate drug formulations. Drug formulation evaluation, in other terms, would be audit. And apart from audit, this evaluation of drug formulation would be helpful in your prescriptions as well. Scan information on common pharmaceutical preparations. A part of it you would be learning at the end of the session. Demonstrate the appropriate setup of an intravenous drip in a simulated environment. IV drip setup, you all must have at least seen or experienced. Either on yourselves if you might have gotten ill and hospitalized, or you must have seen in the hospital visits itself. So how to give an intravenous drip, how to set up those intravenous drips, and how to administer a drug, that would be made available to you. And this simulated environment would be of mannequins. So administer drugs through various routes in a simulated environment using mannequins. What is mannequin? Mannequin suture. See, wherever there is a simulated environment using mannequins, in other words, there is no real patient, but you would be performing the skill required in a real patient by hands-on. કપડાની દુકાનમાં જઈએ તો બહાર જે પૂતળા મૂકેલા હોય છે અને મેનિકિન કહેવાય છે. For hospital setup, there are such parts of human body as a human as a whole. Okay, like a dummy. Good. So it's a dummy human being or a part of human being where you would be given training, hands-on experience, hands-on practice for administration of a drug via different routes. Are you able to see the slides as of now? Okay, just hold on for a second. Okay, yes. So this was skill sets. Next is communication aspects. So communication aspects, which you would be given training on and made to learn is how to communicate with the patient with empathy and ethics on all aspects of drug use. Communicate with the patient regarding optimal use of a drug therapy, devices, and storage of medicines. Explain to the patient the relationship between cost of treatment, and patient compliance. So you must have seen as to whenever you would be visiting a clinic, a doctor tries to understand as to what you're facing, what is your current problem, how to overcome it. He or she should not be a robot. The patient should be explained the optimal use as to how to use the following drugs prescribed or devices which are prescribed and how to store the medicines, and cost effectiveness, which is one of the major factors in drug therapy, because all drugs, there are alternatives available for drugs too, even in a single drug group, and to ensure the patient compliance, because compliance, if not ensured, can lead to other consequences. The assessment can be done. These are different modules of skills, knowledge under various competencies. So this skill set would be analyzed by different assessment methods. First practical, which is clinical pharmacy today, and following that, when you come over here, there will be hands-on training on parenteral drug administration on mannequins. This can be assessed and this will be assessed by spotting exercises, vivas, directly observed with checklist, meaning you must have undergone OSPI stations in your first year. In the same ways, there is a checklist which you need to go through and which will be given to you for experimental pharmacology or computer assisted learning would be assessed by spotting, viva, demonstration, and assignments. Demonstration meaning you'd be given this simulation training on computers itself as to how these experiments are directly performed on computers without the killing of animals. Prescription writing using P drug concept. This P drug concept would overlap with the rationality or the rational drug therapy. That concept will be made, that will be further on covered up in the subsequent practicals. That will be assessed by writing exercises, vivas, and assignments. So rationality of drugs and their Fixed dose combinations. Fixed dose combinations meaning two or more than two drugs which are prescribed in a single formulation. And there are other terminologies of fixed dose combinations which will be made to learn later on. Those also will be assessed. Prescription audit. You must have learned or heard about the terminology audit in finance. The same holds true for prescription. You have to survey, you have to monitor, you have to critically evaluate a prescription under various parameters to get an idea whether the prescription is correct, whether it is missing any details, and how far it is rational. Pharmacovigilance. The terminology would be explained later on in the following slides. Drug promotional literature. Drug promotional literature meaning you must have seen various handouts given to the doctors by MRs, okay, medical representatives who visit the clinics or hospitals marketing the drug. So how far it is the information authentic? How far to what extent is it correct? Whether it is showing just the positive aspects of a drug or is it being not biased? Those things would be assessed via writing exercises, vivas, and assignments. Clinical pharmacology experiments at the end of your sessions, at the end of yours, we have different experiments which are performed on humans, be made to learn and would be assessed via spottings or assignments. You all will be provided manual for each module detail and journal for writing exercises and assignments. This first practical would also be having assignments. You are supposed to write in the journals which would be provided. And as of now, if you wish to write in a separate notebook, just to make it a rough draft of it, you may. So at the end of each practical class, students will be given assignments to complete by the next class. And students, you all have to submit journal regularly, which will be considered for day-to-day assessment. The time of assessment, the date of assessments, all those things are necessary, and you also have marks for it. So this assessment in your internals would carry marks. So please make sure that you regularly submit your journals, complete it by the end of practicals, and get it signed. So coming on to first section, clinical pharmacy, and the first practical, which is introduction to clinical pharmacy. This is covered under various competencies. These competencies include, these are the numbers which are not important for you. And from here onwards, Dr. Maril will be taking over the class.
A very good morning to all. So, this is your first chapter of section 1, that is clinical pharmacy, introduction to clinical pharmacy. The other chapters under this section are the various dosage forms that will be introduced you in subsequent practical classes. For example, oral dosage forms, parenteral dosage forms, topical dosage form, and lastly the OSPI, in which you have to perform the drug administration techniques via intramuscular or intravenous injection on mannequins. So this is the first chapter of clinical pharmacy, that is the introductory section. So here we will cover 4 competencies: 1.1, 1.9, 1.12, and 2.4. Details of 1.12 competency, it will cover in the subsequent or probably next practical class, in which you will learn how to calculate the various doses of drugs and some calculatory parameters of drug. Now, the objectives of today's practical is, at the end of this practical, you should able to define various terms related to pharmacology. You should able to explain various abbreviations related to prescription writing, and you should able to calculate the dose of the drug in a specific population. For example, in pediatric population, geriatric population, or in the patients with liver or kidney diseases. At the end of this practical, you should able to calculate the dose of the drug in a specific population relation to domestic measures. So domestic measures will be covered in subsequent slides, and this is covered under the competency 2.4. So starting with certain definitions, pharmacology. First, the pharmacology word, we can divide this word into parts. One is pharmacon and second logos. The meaning of pharmacon. The meaning of pharmacon is an active principle or a medicine. So the main active drug which is present in certain formulation is a pharmacon or an active drug. And logos means a word logos. The similar synonym of this word is discourse or treatise. The meaning of this word is a detailed study of something. So pharmacon plus logos means detailed study of medicines. So this science, this is a science that deals with the medicines. Pharmacology is a science that deals with the medicines. So it is a detailed study of the medicines, particularly their actions on living animals, organs, or tissues. The actions may be beneficial or harmful. The actions may be beneficial or harmful. So in general, it is the meaning of pharmacology is to understand the mechanism of action of drug on animals or in a specific tissue or at organ. Clinical pharmacology. It is a scientific study of medicine in human being. So when we talk about the human being, then it is a clinical pharmacology. Except the study on animals or organs or tissues, we are particularly studying some effect of some drugs on particularly on human being. There are various fields of pharmacology. One of such field is pharmacodynamics. So what do you mean by dynamics? Pharmacodynamics is a study of action of drugs on living organism. In uh, in short, we can say it is what the drug does to the body. So effects of drugs on body. This includes physiological and biochemical effects of drugs. So drugs can alter our physiological functions, or it can cause some biochemical changes in our body. So how the drug will act in the body, the study of this is known as pharmacodynamics. How the mechanism of action on a particular organ at the cellular level or at a macromolecular level. So the study of drug on the body is pharmacodynamics. The another field is pharmacokinetics. It is the study of absorption, distribution, biotransformation, and excretion of drugs. So in short, we can say what the body does to the drug. Once the drug is administered, how the body deals with that drug molecule, that is the pharmacokinetics. So it is a diagrammatic presentation of pharmacokinetics and pharmacodynamics. So here you can see a triangular yellow triangle is a drug molecule. When we administer any drug in the body, there are various phases that drug has to pass through. The drug has to pass through when applying its action on the body. So the first phase is absorption, distribution, metabolism, and excretion. So all these four phases are included under the heading of pharmacokinetics. The detail of these you will learn in your theory classes also. And the pharmacodynamics is how the drug will act on the different organs or different tissues of our body. So the study of effects of drugs in the various tissues of the body by acting on some receptors or by altering some physiological or pathological functions. So these all are covered under pharmacodynamics. Coming to pharmacy, the pharmacy is something different from pharmacology. It is the art of preparing, compounding, and dispensing the medicine in such a way so that the drug will become more suitable for administration. It will become more effective and palatable. So it is a preparation of some medicines at some laboratory and compounding in such a way that it become more palatable for the administration. Hospital pharmacy, you must have seen in our hospital also, there is one pharmacy where various drugs are dispensed. Hospital pharmacy is a practice of pharmacy at private level or at government setup. And clinical pharmacy is particularly the division of pharmacy which deals with the patient care with particular emphasis on drug therapy. So at the pharmacy, some drugs along with some devices or other medical related substances are dispensed. But when particular emphasis on drugs and particularly for patient care, so such type of pharmacy are clinical pharmacy. Pharmacognosy. So here the word gnosy meaning knowledge, the knowledge of some active principle of the drug or medicine. So pharmacognosy is a knowledge of medicine, how the medicines are acquired from the nature. For example, one drug is cardiac glycosides. So these drugs are used for specifically for heart failure, and these drugs are obtained from one plant, that is foxglove plant. And this plant, so the study of this plant, the study of the source of the medicine from which the drugs are obtained, this study are known as pharmacognosy. Pharmacotherapeutics. Now, once we identify the source of the medicine, we prepare the medicine, we compound the medicine in such a way that it becomes more palatable to the patients or population. Now, if now the actual use of this drug in clinical practice, so the study or the branch of medicine that concern with the cure of the disease or relief of symptoms and include the drug treatment. So the actual use of drug in clinical practice is the particularly known as pharmacotherapeutics. Pharmacoepidemiology. The word epidemiology meaning you will learn in community medicine also. The epidemiology is a study of a distribution of certain disease in large population, and pharmacoepidemiology means the study of effect of drugs on large population. So when this will important when for approval of some for approval of new drug has to pass some clinical trial phases. Phase 1, 2, 3, you will learn in subsequent theory classes. The last phase of this drug trial is a post-marketing drug surveillance. During this phase of the post-marketing drug surveillance, the long-term effect of drugs are measured, and it may be beneficial effect or some harmful or adverse effects of drug are specifically observed at this phase. And these effects are observed on a large population after the marketing of the drug. So it is a study of use and the effect of drugs in the large number of people. This field is applied to the period after drug enter into the market, and it is referred to the post-marketing drug surveillance. So this will provide a valuable information about the clinical and economical outcomes of the drugs as well as devices and some biological products. particularly after their approval of clinical use. Pharmacoeconomics. So the economics is something related to the cost. So once the drug is approved, and it first of all, it is defined as description and analysis of cost of drug therapy. So the total drug therapy is feasible for society or population or not. This detailed study of the cost analysis of particular drug therapy or treatment is known as pharmacoeconomics. The more scientifically, we can say pharmacoeconomic research is a process of identifying, measuring, and comparing the cost, risk, and benefit of the certain therapies, or determining which alternative produces the best health outcome for resource investors. Pharmacogenetics and pharmacogenomics. The difference between these two, you will learn in detail in your journal pharmacology classes, theory classes. But in short, the meaning of pharmacogenetics, it refers to the monogenic variant that affect drug response. So it is the change affect the response of the drug in our body. Whereas pharmacogenomics, it refers to the entire spectrum of the genes that interact and that determine the drug efficacy or drug effect on our body. So the simple difference between these two terms is, in genetics, there is only one gene which is responsible for the alteration of drug effect, while in genomics, the entire spectrum of the genes that are responsible for the drug efficacy and safety. Pharmacovigilance. The meaning of vigilance is to keep watch on something that may cause harm also. So pharmacovigilance is to keep watch on the effects of or the harmful or adverse effects of drugs. It is a process of identifying, evaluating, and responding to adverse drug reactions and safety issues about medical products. The important function of pharmacovigilance is to provide warning signals with regards to previous unknown adverse drug reaction. For example, you can see here the pictures of babies, and it is an incidence in around the 1960s. There was thalidomide tragedy was happened. Thalidomide is a drug which was used as antiemetic in pregnant women for morning sickness. But this drug was not tested for fetal safety before approval and before marketing. So once the pregnant women started taking this drug, and the child were born with sealed limbs. As you can see, the limbs, upper and lower limbs of these babies are sealed. And then this drug was banned for this drug was banned for used as an antiemetic in pregnant women. And since this tragedy, the concept of pharmac, and in detail in detail about this you will learn in a separate practical module which is given in your manual also, in which you will learn in detail. Now, meaning of toxicology. It is the science of poison, dealing with the detection, measurement, and treatment. So what is the poison? It is a substance that causes harmful, dangerous, or fatal symptom in animal as well as in a human being. So details about toxicology will cover in your forensic medicine. So here we will not discuss in detail. Now, drug, the French word of drug, the meaning of French word drug is dry herb. And according to WHO, WHO has defined drug is a substance or a product that is used or intended to be used to modify, explore the physiological system or the pathological state. for benefit of recipient. It is a substance or product that can modify the normal physiological function of our body, or it can alter the pathological state for the benefit of the patients or recipient. Drugs can be used for various purposes. First, it can be used for the diagnosis of disease. For example, some contrast media are used in the radiology. So these contrast media are used for intravenous urography or angiography. Then drugs can be used for the prevention of the disease. Prevention of the disease is also known as prophylaxis. In this COVID era, you must have taken the COVID vaccine. So all the vaccines are used for the prevention of particular disease. So the purpose of giving vaccine is for the prophylaxis, so that we cannot acquire the disease in future. The another purpose of giving drug is for the relief of symptoms. It is for the relief of symptoms. For example, for headache, you must take paracetamol. For the control of disease, for example, insulin in diabetes mellitus. So some diseases are only controllable. We cannot totally cure the disease. One such disease is diabetes mellitus. For control of diabetes mellitus or for control of blood sugar, we prescribe insulin. The another purpose of giving is a cure of the disease. For example, chloroquine is a drug used as the control of fertility. So some oral contraceptive pills are used for contraception, so that the fertility will be controlled. So these are the various purpose of giving drug in various conditions. Now the concept of essential medicine. This is another a practical module. It is mentioned in your manual, and in detail you will learn in that particular practical. But in general, the meaning of essential medicines. These medicines are those that satisfy the need of the population, that are available within the context of functioning health system at all the time, in adequate amount, in appropriate dosage form, with assured quality, adequate information, and affordable price. So, in short, we can say the essential medicines are the medicines that are commonly used medicines and available in our hospital pharmacy also. So, according to the need of the population, the essential medicines are decided. This picture is a front page of the WHO essential medicine list. The latest edition is 22nd edition, which was published in 2021 by WHO. Nationwide essential medicine list are also published. The essential medicine list of India is also available. So the essential medicines are it can be different from country to country according to the need of the population of that country. And there is one link which is present here. Link for the you can open this link for to show the various drugs which are mentioned in the essential medicine list of WHO. Now, what is the dose of the drug? So the dose is defined as an amount of drug which is given at a time and which can be repeated at an appropriate interval to produce desired therapeutic effect. Formulation. So the concept of formulation you can understand by an example. For example, when you want to prepare a food, then for preparing food you require some ingredients, and to make your food more delicious you require some ingredients which are more palatable. Or so similarly, like for preparing a drug you require some recipes or some ingredients so that we can make drug more favorable or more palatable for the patients. So formulation means it is a recipe by which drug is prepared. It contains a list of active ingredients. So the drug main the active ingredient is there along with the excipients. Excipients are the some inactive ingredients which will help in maintaining that such formulation. Some vehicles, flavoring agents or coloring agents along with preservatives. So here in this picture you can see a back of one uh, tablet, wrapper of one tablet, the Valgan cyclovir hydrochloride tablet. So here you can see the active ingredient is Valgan cyclovir in the dose of 450 milligram. Along with this drug, some coloring agents like titanium dioxide and red oxide of iron are present to make the drug more palatable or more palatable for the patients, or more palatable for administration. Coming to dosage forms, you must have seen various dosage forms in your day-to-day life, like tablets, various capsules, hard capsules, soft capsules, and then topical preparations like cream, ointment, syrup, and suspensions. For injectable preparations, so these all are the dosage forms which are used in for various purposes. It is a form it is a form as a in which the formulations can be administered to the patients. So the dosage forms are tablets, capsules, injection, and liquids. In detail of these dosage forms, you will learn in your subsequent classes under this section of clinical pharmacy. You will obtain information of various drugs from different sources. For example, nowadays you can Google any word and Google will give you more information related to any topic. But before uh, having a trust on such information, you should confirm that this information are scientific and authentic. For the drug related information, you can obtain a scientific and authentic from scientific and authentic sources like the textbook of pharmacology, medicine, and other medical sciences. There are some journals you can refer for the recent informations. Uh, Journals and publication will give you the information regarding the researches are undertaken or certain case reports, or you can review some meta-analysis or such things. So for that, for such authentic information, you can refer some publications or journals also. There are some other books. There are some other books you can refer in for detailed information like pharmacopoeias, national formularies. National formularies and pharmacopoeias are different for different countries. So here one is Indian pharmacopoeia, then United States pharmacopoeia, dispensing information, British pharmacopoeia. So country-wise, the pharmacopoeias are different. So in pharmacopoeia, you will find detail of some medicine. For example, how the active ingredient of that medicine was obtained, the source of medicine, how the medicines are prepared in laboratory, how they are compound. So all this information in detail you will find in these books. Another books like monthly index of medical specialties, current index of medical specialties, Indian drug review, drug index, drug today. So all these books are will keep you updating for newer brands of various drugs coming in the market. So in these books, you will find various brands of various drugs along with their dose, their indications, their in which schedule they are there, and their contraindications, adverse effects, all will you will find in these books. So for authentic source of drug information, you can refer these books also. Like has mentioned regarding the drug promotional literature. So it's a example of one such literature. You may find in the clinics on the doctor's table. You will find such type of literature that will be carried by some medical representatives for the promotion of their uh, drug, or for the promotion of particular pharmaceutical company. So in detail of these drug promotional literature, we learn in subsequent practical class. You have to audit such literature also. So it is one of the your practical module that you will learn in your subsequent classes. National formulary. National formulary includes formula for pharmaceutical preparation, just like pharmacopoeia. You will find here again the how the some medical dosage forms are prepared. For example, elixirs or solutions, tinctures, powders, whose use or effectiveness is reasonably certain. National Formulary of India is published by Government of India. So country-wise, the national formulary will differ, and you can refer national formulary for authentic sources also.
Okay. So before moving forward, I'll require your attention for 5 minutes. Every single person, all the participants, will go through a quick recap of all the definitions. You learn various terminologies. All those terminologies will be used in one way or the other throughout your year. Okay. So before going on to the next session of measures of weight, the slide which you can see here, we'll quickly go through definitions. Okay. Please pay attention. You started with pharmacology, definition of pharmacology. Okay. Split it into two words, pharmacon and logos. So active principles and its detailed study, particularly in living animals, organs or tissues. This actions may be helpful or harmful. Next is clinical pharmacology, where you scientifically the study of medicines in human beings. You studied various fields of pharmacology. Remember the diagram of kinetics and dynamics. Kinetics, in other words, is motion. So imagine something moving through your body through different phases of absorption, distribution, metabolism, and excretion. Dynamics, in other terms, is action. So how the drug acts in the body, that is dynamics. Pharmacokinetics, pharmacodynamics. Coming on to pharmacy, it's an art of compounding, dispensing, and preparing. So you prepare a medicine, you compound the medicines, and dispense the medicine. So preparation of medicines, in other terms, for making it easy to administer, effective to administer, and ensuring patient compliance. So those things are covered under pharmacy. Hospital pharmacy, remember the diagrams, hospital pharmacy, clinical pharmacy. So practice of pharmacy in hospital setup, government or private. Clinical pharmacy includes this application of pharmacy in patient care. Pharmacognosy, there's a diagram of some plant as an active principle and the study of it. As Dr. Murray mentioned, it's a foxglove plant. It was just an example. You will learn all those things in the later. So it is the study of identification of the active principle, identification of the source of active principle, and studying the properties of these medical substances. Okay. Then comes pharmacotherapeutics. That is, after application and identification of the medicinal substance, you apply that active principle or the formulation as a whole in treating either the symptoms or curing the disease. So that is pharmacotherapeutics. So use of drugs in clinical practice. Then is pharmacoepidemiology. Epidemiology, in other words, pertains to population and study in the population itself. So study of use of drugs and its effects in large population or large number of people. Post-marketing surveillance. Remember this term for now, which was mentioned earlier. You again go through it in the various clinical phases and clinical trials when it is made to learn. Pharmacoeconomics. Economics pertaining to cost. So description of cost and its analysis of cost. So cost benefit analysis of drug therapies. Pharmacogenetics and pharmacogenomics. Genetics meaning single gene variant, genomics meaning an entire spectrum. So study of the monogenetic variants on drug response and study of entire spectrum of genes on a drug response is genomics. Pharmacovigilance. Vigilance, in other words, is monitoring, active as well as passive monitoring or surveillance, in other words. So you identify, evaluate, and respond to various adverse drug reactions. That was one of the initial competencies which was mentioned. It was under your skill set. So you need to identify various drug reactions and safety issues with administration and prescription of drugs. Toxicology will be covered in forensic medicine toxicology, but it deals with the toxic parts or toxicity aspects of a drug and substances. Then coming on to drug itself, as to what is it, how is it supposed to be used, and where is it supposed to be used. So that is the definition. Coming on to essential medicines. Essential meaning it should be required at all times, available in the right dose, right formulation. In context to the health system, you would be learning this terminology even in the preventive and social medicine also. So જે દવા જે ટાઈમે જે જગ્યાએ જરૂરી હોય એટલી ક્વોન્ટિટીમાં એ ડોઝમાં એ ફોર્મ્યુલેશનમાં એ પોપ્યુલેશન માટે અવેલેબલ હોય, that is essential medicines. Then three important terminologies of dose, formulation, and dosage form. Dose is the amount of drug which can be repeated at various intervals to produce desired therapeutic effect. Formulation, as ma'am said, it was a recipe. So that entire recipe contains the active ingredient itself along with other substances to ensure its kinetic, favorable pharmacokinetics, favorable pharmacodynamic parameters, and ensuring patient compliance. Next was dosage form. There was a diagram of tablets, capsules, liquids, syrups, injections, topical preparations, all those things you'll be learning in coming practicals, various dosage forms. Different sources of information. These different sources of information were explained. It was also covered by Dr. Bharat sir in the previous classes also. So different textbooks, journals, then other diagrams of pharmacopoeias, national formularies, and various drug review books, that is SIMS and drug index, all those things, the diagrams were covered up. So these are the various sources of information which you can use for to have up-to-date and scientific knowledge from different authentic sources. Another diagram which was mentioned at a later stage was a drug promotional literature. So those will also be evaluated by you as an exercise and as assignments. You will be made to learn. Clear? So this was a quick recap of all the definitions per se. Go through those definitions again. They would be asked in your theory as well as practical parts. Okay. And their applications are much more important. Coming on to the next competency which will be covered today is understanding different measures of weight. You all have gone through these conversions. This is just a quick recap of conversions, and these measures will also be seen as domestic measures in the next slides. So 1 kilogram is 1000 grams, 1 gram is 1000 milligrams, 1 milligram is 1000 micrograms, micro converts to nano, nano to picograms, and finally femtograms. If the same is in liters and microliters, you convert it accordingly. Okay. Go by 10 raised to minus 3. ઊંધું જતા જવાનું એટલું એનું subsequent division થશે. Do remember the units and the abbreviations. Units, abbreviations, and the entire whole name of it. Because where you'd be required to use abbreviations, where you cannot use abbreviations just to avoid patient errors and dispensing errors, that will be made to learn. 1 liter is equal to 1000 milliliters. So these things are you are familiar with. The less familiar aspect of it is domestic weights and measures. These are all the things which you would be using and the doctors frequently use for giving patients instructions as to how much of drug is required to be administered. We don't have 5 ml, 10 ml, 15 ml syringes at homes, okay, for accurate calibration or for other measures. So what we do have is spoons, glasses, tumblers, drops. For drops, droppers are available in the medicine itself, the container itself. So this volumes, weight and volume equivalents you are supposed to know for accurate dose administration. So 1 drop is equal to 0.05 ml. And so 1 ml is approximately equal to 20 drops. 1 teaspoonful is 5 ml. 1 dessert spoonful is equal to 10 ml. 1 tablespoonful is equal to 15 ml. એક ચમચી દવા લેવાની એટલે 3 અલગ અલગ પ્રકારની ચમચીઓ છે. So whenever you ask a patient, you need to keep, you might be thinking that I wish to administer 10 ml of a drug to a patient once a day, twice a day, thrice a day. But એક ચમચી લઈ લેજો, એક ચમચી કેટલી છે, કઈ ચમચી છે, that might differ. And patients would not be knowing these terminologies. So commonly teaspoons and tablespoons are available in almost all houses. Okay. And if not teaspoon, tablespoon is also નાની ચમચી, મોટી ચમચી એવી રીતના તમે કહી શકો છો. But for exams, for vivas, for assignments, for exercises, you need to know these conversions. 1 teaspoonful is 5 ml. 1 dessert spoonful is 10 ml. 1 tablespoonful is equal to 15 ml. 1 glass full is 150 ml. 1 tumbler full is 240 ml. These domestic measures and their metric equivalents you would be applying in your next practical also. Calculation of drop factor and droplet of intravenous infusion. Whenever as an IV drip is set up, there are drops and the drop rate is set up by a roller. So that would amount to exact dose. As we learned in the previous slide, 1 ml is equal to approximately 20 drops. So that drop factor is number of drops per ml. And drop rate is total volume of infusion in ml multiplied by drop factor upon total times in minutes. And the right side the blank which you see, it's actually multiplied by 100. So total volume of infusion into drop factor upon total time in minutes. That's how you set up a drop rate via infusion. Clear? Domestic measures and setting of drop rate. Total volume into the number of drops per ml upon total time. The next thing which you're supposed to know is various abbreviations and what do they mean. The prescription should be written in simple and or in regional language without using abbreviations, ideally. But however, there are certain Latin abbreviations which are still in use, mostly in hospitals, and you should know them. First is antisebum. So antisebum, the abbreviation is AC. It implies before meals. Post-sebum, the abbreviation is PC. It means after meals. જમ્યા પહેલા દવા લેવી, જમ્યા પછી દવા લેવી, રાત્રે સૂતા વખતે, ભૂખ્યા પેટે. All these instructions have, all these dosing frequencies have various abbreviations. So that is something which you should know. Then is Horasomni or HS. HS meaning at bedtime. Opus, bis indi and ter indi and quarter indi. So OD, BID, TID and QID. They imply once a day, twice a day, thrice a day and 4 times a day. Once, twice, thrice and 4 times a day. C opus sit or SOS. This is a very common terminology which you would be seeing more frequently in the clinics. Is as and where required. જ્યારે જરૂર પડે ત્યારે SOS લઈ લેવી. That means whenever it is required, you can take this. Okay. Common confusions happen between AC and PC particularly because post-sebum or PC can be implied as post meals. Next thing which you should know is how to read a label of a drug. દવા બધાએ લીધી હશે. દવાની જોવાનું and what is its importance. That is something which you should know. So if you have your screens, you all can zoom up on this right side diagram. What you should read in the label is what is the name of the drug, what is the dose of drug. The name of the drug can be written as brand name and generic name, both. So you should be able to read the name of the drug, dose of the drug, batch number of the drug, manufacturing and expiry date, what is the maximum retail price of the drug, schedule of the drug. The schedule of the drugs you would be written in different boxes. Schedule H, Schedule P, Schedule X. There are different schedules. Instructions about use of the drugs. Now, commonly, the instructions would be as directed by the physician. In some scenarios, it is very particular, so that would be mentioned in the dosage form itself on the strip or blister pack. And address of the pharmaceutical company. So if you can zoom in here, the Ocasert is the brand name. Here's the name of the drug. The drug itself is cetirizine hydrochloride tablets. It is 10 milligram tablet. The type of tablet is a film coated tablet. Each film coated tablet contains cetirizine hydrochloride, as you can see, 10 milligram. You learned earlier about formulation, so that contains colors, excipients, preservatives, any other vehicles in which the drug is prepared. Here the color is mentioned, that is titanium dioxide. Okay, so these are drug related details. Batch number, as you can see here, it is mentioned in the strip B280103. This is batch number. Manufacturing and expiry date, MRP is mentioned. Schedule of the drugs you can see here in the box. It's a schedule H drug. There's a warning which is written that it should be given by registered medical practitioner only. These schedules have their own meanings. Instructions about use of drugs. In here is all it's written as directed by the physician. So you'd be learning as to what drug is to be given by which dosing regimen. Address of the pharmaceutical company. Here you can see there's a address of Cipla where it is mentioned industrial area 1 something something it's mentioned. So all these details would be there in the label of a dosage form. They would be mentioned not in a particular sequence, but all these details should be mentioned and would be mentioned. You should be able to read these things. Clear? And these are your assignments for today's practical. You can take a screenshot of this. You can have a rough draft, and whenever you have your journals with you, you can write those things, these assignments in your journal itself. Okay. First is enumeration of various information given on the label of the containers of medicines. So that is your previous slide, all these things. Okay. Then second assignment is what do you understand by the following terms? Mention the clinical importance of each of them. So we had these terminologies. Now, why are these important to be mentioned on a blister pack or a strip of dosage form? What is the importance of manufacturing date, expiry date, batch number, cost of the drug, schedule of the drug, those things. The third question is expand the following. Now, expand the following would include dosage form, whether it is capsule, tablet, syrup, in those sense. Drug itself, either by brand name or generic name. An example is FeSO4, that is ferrous sulfate. So dosage form, dose of the dosage form, the drug itself, either by brand name or generic name, dose of the drug, and the entire frequency as to when it is supposed to be given. So those things you are supposed to write as assignments. Expand the following. I hope you get an idea as to what I'm trying to say. These things you have learned in your previous slides. What are the abbreviations? What the doses imply? What are the full forms of doses? Nanograms, picograms, all these things you know. So these are your 3 assignments for this session. Clear? In the next class, there was one competency which was measured, which was the measure of different doses in specific populations in relation to domestic measures. So dose calculation, we learned this on this previous 2 slides for drop rate calculation for intravenous or infusion. And second is different domestic measures, whether it is glass full, teaspoonful, tumbler full, those things. So dose calculation in geriatric, pediatric populations or in renal or kidney insufficiency diseases, those things will be in next class. That's all for today. If you have any questions, if you have any doubts, you can ask us in the chat box.